Well, I just want to thank everyone for joining today and wanted to give a little extra time to make sure everyone's had some time to trickle in. We're really excited to talk about the webinar today and launched the partnership with Hinkley Medical and ESO's EHR, and we believe that this is another advancement in technology for EMS professionals. So in today's webinar, you'll be hearing from me. I'm Colton Hazlett, the co-founder and CTO at Hinkley Medical. I've been doing it from the start at Hinkley Medical for about the past 5 years, and I'll let Gina introduce herself.
Great, thanks, Colton. Yeah, my name is Gina Kirkwood. I'm a staff product owner at ESO. I work on EHR Web and EHR Windows Mobile. I've been in the digital health industry for quite a while, and I've been with ESO for just over 3 years. So it's a pleasure to be here today and to introduce this integration to you all. And I really feel that you'll think that is very useful and helpful. So happy to be here.
Awesome.
This is a combined presentation with Hinkley Medical and ESO, but ESO doesn't have one single PowerPoint go by without introducing and talking about our mission here at ESO. And I know OneDose, lives by the same mantra, if you will. So we're making a difference to improve community health and safety through the power of data. That is ESO's mission. With this integration, we're allowing, less duplication of data and allowing providers to spend less time on documentation and to spend much more time with their patients and doing patient care. So I hope that, you'll see how this integration can serve to this mission as well as we have.
Absolutely. So in the webinar today, we'll talk about a couple of things in the agenda here. So we'll introduce the EHR and OneDose integration, kind of what entails it, where it's available, and what data points could transfer over. And then we'll jump over into activation and the setup, all the way from the ESO side on next steps and how to get that kicked off. And then to the OneDose side, getting it fully up and operational so you can start eliminating the redundancies of duplicating the information and instead just sending it right over to ESO. Right after that, we'll give a live demo of the OneDose to ESO integration as well. Talk about what's coming next with the integration from the ESO side on the data points, and from the OneDose workflow side, what is going to be coming with the integration as well, how to get started with it, the next steps to actually implement the integration, and at the end, we'll open it up for any Q&A if there's any questions about the integration at all. So the EHR and OneDose integration is available on EHR Web, Windows, as Gina was mentioning, and it's soon to come out on that iOS. As for on the OneDose side, it's fully capable on OneDose mobile app right now, and is coming soon as well on OneDose Web. We really set this goal off to meet our goal, which is to eliminate the redundancies as mentioned, and really enable the provider to allow for more accurate documentation at scene, to enhance protocol compliance and to have more accurate and reliable records.
Yeah, and I'll just jump in that, on EHR, we know that how much documentation that providers have to deal with to, document PCR. So, we're very happy, at ESO to partner with people such as Hinkley Medical and their OneDose application to, in any way try and reduce the burden of all of the documentation that you have to do. So this does eliminate duplicate data entry, and we're hoping that and we'll be enhancing it as well in the future. So allowing you to be, closer to that patient at all times. So we're very excited for it.
Yeah, and real goal of Hinkley Medical with the OneDose solution is to really reduce that stress on the provider, especially on those late night calls at 2 a.m. when you're in the back of the ambulance working with a child. And all you really need to know is just quickly reference that medication dose. Along with that, now you can actually get those accurate timestamps and then send it over to ESO.
Yes, and speaking of data, and talking about eliminating the duplicate data entry, just this is just kind of a table view of what data can be entered into OneDose and then sent over to EHR. So, patient weight and age, flow chart, treatment medications, with the dose information, the timestamp of when it was administered, um, you know, other time-based medication details as well. Then, defib and cardio flow charts, such as data such as shock type and the timestamp as well. And then for airways and other treatments, the success, usage, and timestamps, of course, always on everything. And then CPR, IV therapy, and other protocol-driven treatments as well. So that's just a quick view of some of the data that's being pushed over today. Now we'll get into activation. To start this process, first and foremost, there is a sales process with ESO to be able to get this integration. So you do have to contact, if you have an account rep, you can contact your account rep. If not, you can email support and they will do a sales referral for you. Or you could email sales as well. And there's a slide at the end that kind of summarizes that information. But essentially what happens is that after you have gone through the sales cycle, it goes to our onboarding team and they essentially turn this integration on for you on the ESO side. And then you would receive an email from our onboarding team letting you know that you can now go in and do all of your setup on your side. And so I am going to just demo quickly how we kind of do, how you would do that. So let me go into, still see my screen okay?
Yep.
Okay, great. Before I go into admin, because that's mostly where you do all the setup, I do want to just point out that we have, on our dashboard, you have this product training link. Hopefully you're all familiar with it. But if you click on there and then if you go into more resources and then you choose EHR and then you choose PDFs, since this was released so recently, the two documents that reference basically help documentation to do the setup for this integration, or even there's a help documentation for the end field providers as well on how to use the integration. And they're just listed here. I just have them open already. So, just for your reference in the future that these are available, to utilize. And what you would do, what our recommendation is when you are going to set this up, you would go into admin. And first and foremost, you would go to roles. Now, you don't have to create a brand new role, but our recommendation would be to create a brand new role. That's what's listed inside the help documentation. And, we gave it a name of, say, EHR Partner API Admin. And you hit next. You don't want to choose a template. You just want to hit next. And then when you go to this next screen, it basically gives you all of the different permissions in EHR. And I'm sure maybe some of you are familiar with this already. But if I choose for data API permission, you'll see that there's one here and it's called Fire Incidents Data API Administrator. And you're going to turn that on. I know it might be a tad confusing that it's called Fire Incidents. It's just that the fire team built kind of this whole data API, public data API infrastructure, and we're kind of coming in behind them because the structure was already there. It was much quicker for us to build it in that manner. So maybe someday we'll genericize that permission, but this basically allows you access to the EHR Partner API. And then you hit done. And then essentially you would, then you would find that role and you would add all of the users, that you want to be able to have access to do this setup. So obviously I'm just doing myself here and I'm already set up. But then, once you add the user to that particular role with that permission, and that user logs in and they come to admin, then they would be able to see this API management section way at the bottom here on the bottom left of your admin screen. And if you click on that and then you choose subscriptions, then you would see OneDose here. And then what you're going to do is you're going to have to generate the API key. I'm not going to do it here because this is what's connected to Colton's and I don't want to mess anything up. But you would just click the regenerate button, and then you can copy that API key. And then once you have that, then we're going to move over to the OneDose side and finish our setup over there. So I am actually going to, come on. Why is this here? Move. Thank you. I'm going to stop sharing and let Colton share to show the setup on the Windows side.
Awesome. Can you see my screen?
Yes.
Nice. So at this point, if you log into the OneDose admin console and you have fully got up and operational with us on the OneDose side, you would route to the settings and integrations tab. If you're seeing a screen like this is where you actually have to reach out to us, very similar to Gina and the ESO team, where we actually have to configure ESO to be turned on for your agency. If you press this, it sends us an email right away, and then it'll switch over to having a screen similar to this, where it says you can set up the ESO integration now. At this point, this is where that API key that Gina mentioned will come in. If you paste this will actually connect your OneDose agency account to that ESO agency account, so we can have that reference for where we actually need to send the logs to. I won't do it right now because I already have this all set up just like Gina, but I will jump back over to the account that we have set up. So when it's all said and done, you'll see a checkbox like this, and it'll immediately log you into our audit connection. At what point it pulls all the medications that you have enabled in ESO and actually will cross-reference them with OneDose medications as well. This is one that's already fully done. It is also a very nice tool to know that you have this because you're able to see each individual OneDose medication to ESO medication to make sure that all the pairings are correct at any point. And then after that, assuming everything's all done here, you can save these pairings, and then the next time anyone opens up OneDose on the mobile application side, you're fully integrated with ESO. And at any point, if you have any questions similar to what Gina brought up, there's documentation. There's also a little training documentation that we created that goes through the OneDose to ESO side here, and kind of how it all maps together to have some more information about that as well. Awesome. Now I'll jump back to the presentation. Looks like it didn't work.
Oh, the presentation has the demo next, Colton.
Awesome. All right, can you see my screen?
Yes.
Awesome. So now we'll jump into a live demonstration. So on the left here, I'm logged into our OneDose account. And then on the right here, I already came in here. I already know that I'm going on to a call. So I opened up a ESO EHR report. So the first thing that we do when we go into OneDose is get some information about the patient inputs. So if you know that you're going on a call and you know that you're dealing with, say, a 9-year-old, and that's all the information that you have currently available, which happens all the time from dispatch, you can use that age-based formula to estimate that patient's weight. So if you know that you're dealing with a 10-year-old, you can add that 10-year-old into the slide bar, in which case it'll give you that estimated weight of 40 kilograms. As soon as you launch that, add that inputs, it'll start incrementing in the top right, indicating that you've started a patient interaction. At what point everything will now filter down to the patient inputs. So if there was any adult weights, adult medications available, they can all be filtered out and now only display the pediatric medications, for example. A lot of the times we find that if our medics already know which medications to give right away. So if also in the dispatch information, you know that it was a car accident, you might know that you need fentanyl right off the bat. So you can go into your medications and then you can see all the protocols based off that medication right away. So in a car accident, you might need fentanyl for pain, which it'll route you right to it. And then you can see any of the referenced medication doses off of that. At any point, you can always slide over to access that PDF, but now we'll get into the actual documentation and data points side of it. So if I administer one of these fentanyl doses and decide that we actually need to intubate this patient, you can run over to your other protocols and go to your medication assisted airway, RSI, RSA, any terminology for it. At which case you can administer more medications, such as you gave etomidate and sux. And then say you do need to intubate the patient, but you are unsuccessful in getting that ET tube, but you were successful getting that IGEL. Then you can time step and get that status of the equipment itself. And now in this interaction, you can run over to the bottom left, which is all the information that is tied to the patient itself so far. So there are medication doses or equipments that were used here as well. For the sake of transferring data points, I'll go through the other items that we can have as well, which is infusions, which is what we call time-based medications. So 20 to 100 or 20 milliliters per hour, for example. I'll log that. I'll jump to electrical, say we gave cardioversion as well, and we gave 2 of those. And lastly, another data point that transfers over is actually our Glasgow coma score. So say we went in here, we went through the entire scoring process to get an output of 13, and we can save that as well. So just to repeat, I added that just for the sake of this demonstration so we can see it transfer over to ESO. I'll also give this a unique name so we can see it is this log. Now, at this point, this is ready to get exported to ESO. The call's over and you're done with the patient, for example. At any point, you can press this ESO button. There's a 3 here because there's still 3 inputs that are required, which is the administration route that was given to the patient. So say we were able to get IV access here, we can save those. And at this point, this is the final review stage. So this is what is going to be sent to ESO itself. If everything looks correct here, you can press that export button, and then it will send it over to ESO. So now I'll jump over to my chart that I already opened earlier. If you route to the flowchart tab, assuming that you have OneDose enabled, you can go to import, in which case you'll see OneDose pop up here. If you click into here, you can see that case number that I added just for this call here, in which case you can click that and press receive. So that added that etomidate, sux, our ET tube IGEL, and the cardioversions as well. That also added the patient demographics, the weight that was used during that OneDose call, and that Glasgow coma score right here. At any point during this call, if you decide that you grabbed the wrong call and that was actually not me, there is an undo button. I always like to bring that up just in case you ever need to undo everything that was imported as well. Awesome. Is there anything else that you would want to add, Gina, on the ESO side?
I don't think so. No, that was great, Colton. Thank you.
Yeah. So now I'll jump back to the presentation. Awesome. So
Okay. Yeah, what's next? Okay, so I think yeah, so what Colton showed you, you can see that the integration is already offering a lot of value. But EHR is quite huge and there's a lot of data points. So we are still going to be continuing to add to this, trying to slip things in here and there. So data points that will be coming fairly soon would be date of birth, being able to flag if the weight of the patient is an estimate, pediatric color coding, appends to the narrative. So we would be adding to the narrative in the PCR, not copying over. Comments in any of the flowcharts, so the medications or the airways or anything essentially that's being sent over from OneDose that's a flowchart into EHR. The comments would be able to be mapped. Protocols used, and then the size field on flowcharts as well. So we're actively working on those and to be deployed sometime this summer, hoping midsummer, beginning of August, and then OneDose would have to do their part and code to that we those data points that we release. Then further out, we'll be wanting to look at the pain scale and also the run type. We have longer term aspirations as well to allow attachments. So eventually we'll just be adding and adding to this, so it's very, very robust, allowing things such as attachments to be added and so on. But that piece is not yet committed to the roadmap, so I just don't have a timeline for you on that one. But these are all in the works.
And on the OneDose side, more on the workflow of kind of how it could be integrated, we're also wanting to expand by integrating procedures and anything on the ESO treatment side into a checklist. So you can enable IV started directly into a checklist to get that timestamp that can be imported into ESO as well. Along with that, we're just want to ingrain deeper into the OneDose application to have more generic procedures to really allow for more accurate timestamping, and is the goal of that. I do like to bring up as well, this is a really cool feature that ESO just launched, which is the AI generative narrative as well. With the OneDose information, having that a little bit more accurate timestamps, it can really help benefit on the generated narrative as well.
Okay, yeah. So how to get started? I mentioned this a little bit earlier, but this is just kind of summarizing it for you. You can contact your account rep at ESO if you have one. If not, you could send an email to basically EMS and fire sales, or you can simply also contact support. They're pretty versed in this integration and they know that they could send you, to a sales referral and so on. So those would be the 3 different options to get started as well.
Awesome. And on the OneDose side, again, we already mentioned some of this, but you can either contact very similar your Hinckley Medical sales rep. We have a help desk email similar to the sales email. And there is always the request integration button directly in the admin console itself, which will notify us as well. And that is the most of it. And now we can open it up for Q&A. We have our emails located here as well if there was anything that you don't want to ask directly in the webinar itself. And the easiest way to do that would probably be through the chat.
Yeah, there was a Q&A. A couple came in from Q&A. I can read them out. I did answer them.
Okay.
Someone asked what the cost is of adding it to EHR. I don't have the exact numbers right with me, but it is a recurring yearly fee and it's tiered. It's a tiered pricing structure based on call volume. So most certainly when you speak, to an ESO sales rep, they'll be able to figure everything out for you. But they would be your point of contact for that. Um, and then someone asked, they said, I have OneDose already for a different organization. Do I have to download OneDose again? Or is there a way to merge them in one? So we may need to speak. I mean, each agency instance inside EHR has to speak to a OneDose instance. Um,
Mhm.
so, it would have to be set up again. That's my understanding of that.
Yeah, and I can shed a little bit more information on that as well. So Gina is absolutely correct. When it comes to an agency, it's all configured agency to agency. So it'd have to be its own instance. Although for your use case in particular, if you belong to two agencies that are both using OneDose, we actually do allow for the individual user to subscribe, is what we call it, to more than one agency. So if you have that sign up codes, the department code and sign up pin, you can add a separate agency that is outside of the original one that you're working with to your account itself. The benefit of doing that is that offline capability that OneDose offers. If you do add a different agency, it will cache everything on the device. So that way, if you do need to reference the other agency's information, you don't have to log out, require that internet connection if you're not able to have a stable internet connection. Everything will be cached on the device itself. And
There's another question. Is it possible to get CEUs for this training? I am acronym deficient. What is CEU?
continued education credits, I
Okay.
believe. Yeah. That's a great question. Uh, we'll have to look into that one a little bit further. We have the information for everyone involved, and we have done that historically in webinars that we've hosted. So that is entirely possible, and we can follow up with you for that. And
Okay.
then, will we ever be able to get information from ESO into OneDose, past patient history, for example? That's a great question. One part of where OneDose currently stands as of right now is we're a non-HIPAA regulated product, and this was intentional by design to allow OneDose to be installed on anyone's devices and not have any of the HIPAA regulations for that by itself. Although there, that is definitely something that what we have looked for in the trajectory is to have the ability to give more real-time information that could be relevant to the provider. As for the ESO side, I'll let Gina expand there.
Yeah, I mean, we have a past history field, in EHR. We can expose that in the API. It would be just more getting it on the list of, and was it, in order of the different things that we're going to be, providing in this integration in this API. So absolutely, if that's something that, if there's different pieces of data points that inside EHR that we're not pushing over from Windows into EHR today that people think would be relevant, absolutely let us know. This is a good example, and Colton and I can explore it.
Awesome. And Jared Kit asked one more, is there a cost in the OneDose side for this integration? So how OneDose software plans work is we offer individual packages for the purposes that you would want. So if you do want documentation and integration, that's just all involved in our premium package. And that comes with everything that we offer within the OneDose platform. CPR assist to track your metronome, epinephrine timing, and defib shocks, along with EMS calculators that we demonstrated today, and all the documentation services with that integration as well. Well, all right. If anyone else has any questions beyond anything that you would want answered live during this webinar, their emails were in the presentation as well. So you can feel free to ask any questions or to anyone on the Hinckley Medical or ESO side. But I would like to thank everyone for joining the call again today. And really, we're really excited about this advancement and being able to push this information to the EHR and really streamline for the medics.
Yeah, ditto for me. Thank you so much for joining and taking the time to hear Colton and I talk about this great integration. And I hope we'll be chatting with you in the future.
Awesome. Thanks, everyone.
Thank you. Thanks, Colton.